Now, one of the things that we've done that you should not do is I've removed a portion of the medulla so that you can see some of the anatomy right here. Now, there's a very important nerve. This is cranial nerve 11, the spinal accessory. It comes from the spinal cord, and it courses up through the foramen magnum and heads towards the jugular foramen right there. And as it approaches the jugular foramen, it is joined by rootlets of cranial nerve 10, multiple rootlets coming off here, and then finally a smaller glossopharyngeal nerve, all heading towards the jugular foramen, which is located right here. And then slightly cranial to that, we have two more nerves. There's a large one right here and a smaller one next to it. Actually, another one down in here that you can't quite see. Those are 7 and 8, cranial nerves 7 and 8, the auditory nerve and the facial nerve. So as you're removing the brain, what we would like you to do, first of all, don't remove the cerebral hemisphere, but as you're picking up the brain and peering in and seeing these nerves, we'd like you to cut them about halfway between the brain and where they exit from the skull. The way that you would actually do this is I'm going to cut laterally along the spinal cord to cut all of the ventral and dorsal rootlets as they go down to form the spinal nerves. Okay. You're going to pick up the stem of the spinal cord. Now you can see, look at this very, very large vertebral artery. It's actually quite asymmetric, so that in this case it is asymmetric. You can see the one on the other side is smaller than the one on the left side. So cut those on either side. And then in a way that I indicated before, you're going to peer up through here, and any of the nerves that you see extending between the brain and where they exit from the skull, cut them about halfway. Last structures to be cut are going to be the arteries. That's the internal carotid on either side. Cranial nerve 3 is there, and then if you extend the cut superiorly, you'll go through the optic chiasm and the brain will come out. The brain, you have the opportunity to look at some of the stumps of the cranial nerves which are left behind, and we'll do that now. We've already seen the spinal accessory nerve, number 11, as it came up from the spinal cord going up towards the jugular foramen, and that's it here. And then just anterior to it, we have the vertebral artery on this side. And I'm just going to pull it aside a little bit, because if it's a long stump like that, you have to look under it in order to see the fibers of the hypoglossal nerve, which are right here. There'll be multiple fibers going out through the hypoglossal canal. By following the spinal accessory nerve up, it'll lead you to the jugular foramen, and there will be numerous nerve filaments here, because cranial nerves 9, 10, and 11, the glossopharyngeal, the vagus, and the spinal accessory will all exit from this foramen. Now the next is a little bit superior and anterior to the jugular foramen, and this would be the internal auditory canal here. Cranial nerves 7 and 8 will pass out through here, and obviously they've been broken away as we remove the brain. 7 is the facial nerve, and 8 is the auditory and vestibular nerves, which will go out through here. Now, we're working our way anteriorly, and the next is cranial nerve number 6. It will be found on this sloping portion of the occipital bone here, and a little bit closer to the midline. This is the abducens nerve, and it's entering the dura right here. Slightly anterior to that will be another foramen, and exiting through this little foramen, or actually a fairly large foramen, will be the trigeminal nerve, number 5. Now 4 is kind of hard to find. 4 is the trochlear nerve, and what I have here, this is the free edge of the dura as it forms the tentorium cerebelli. And in the region of 5 and 6, you look across here and there will be a very, very small filament that you can see right here that enters the free edge of that dural sleeve, and that is the trochlear nerve right here. Slightly anterior to that will be a much larger oculomotor or third nerve, which you can see right here. Now, in this region, we have a number of structures which you should look at in addition to the oculomotor nerve, which is right here. Just anterior to that will be the internal carotids. As they've come up, this would be the area just distal to or inferior to the circle of Willis, which would be on the brain right up in this region. So we have the two arteries here, and in the midline we have a fairly large stalk. This is the pituitary stalk, and the pituitary will be left with the dissection here. It's in a pit surrounded by dura, and that's what keeps it in place. So this is the stalk of the pituitary, and then just anterior to that will be the optic nerves. The optic chiasm may be present depending on where you've cut it. So we have two optic nerves right here. This would be cranial nerve number 2, and then finally you have to look on the brain basically to find the olfactory tract, and at this point right in here in this depression we have what is called the cribriform plate through which the olfactory nerves will be exiting the skull. We'll now look at the arterial supply on the base of the brain. The two major arterial supplies are of course from the vertebral system, which is here. You can see the two vertebral veins, arteries coming up. Don't forget, it's not unusual to see asymmetry here. One can be much larger than the other. And the other supply is coming up from the carotid system, so this would be the internal carotid here. So these will be connected via the circle of Willis, and we'll look at that anatomy right now. So we have the two vertebrals coming up, and they're going to join to form one vessel in the midline going up along the brainstem, and that's the basilar artery. And this artery will come up and then bifurcate to give rise to two large arteries, which are the posterior cerebrals. And they're just shown right here. And you can see coming from the cerebral and going anteriorly is going to be a small branch right here, which is called the posterior communicating artery, and it is going to be a passageway for blood between the vertebral system and the carotid system up here. So it's connecting those two systems. That's the posterior communicating artery. Here we have the carotid system right here, and it is going to give rise to a middle cerebral artery shown going off here in this direction. Can you see that? Good. Here. And there will be a second artery coming off from it going in an anterior direction, and that will be the anterior cerebral artery coming up in this direction. Now, in order to see those anterior cerebral arteries, you're going to have to break away some of the arachnoid so that you can separate the two cerebral hemispheres like I'm doing here. And you can see the anterior cerebral on one side and the other. And if I take my probe and pass it down between those two arteries and then pull up, you can see that there's a small communication between the two of them right at the tip of the probe there, and that would be the anterior communicating artery, so that it would be just connecting the two anterior cerebrals. So taken together, as we go from the basilar to the posterior communicating, to the carotid, to the anterior cerebrals, we have our other communicating in the front, we get to the other side. This constitutes a full circle, which is called the circle of Willis. At this point, we're going to look at a little more detail at the dura, some of its reflections, and the sinuses, which are encased within the dura. We've already looked a little bit at the superior sagittal sinus. You can see it coursing along the midline going posteriorly. And we've also considered the veins that we saw on the surface of the brain here beneath the arachnoid as they pierce the arachnoid to gain access along the length of the superior sagittal sinus, so that this blood, which enters the superior sagittal sinus, will course posteriorly back along the superior sagittal sinus to an area in the back of the brain here, which is called the confluens. And it is called the confluens because it's receiving blood from several sources. That blood, as it is going to leave the skull, will now go in a horizontal direction. This is called the transverse sinus. And then finally enter a sinus here which goes deep along the petrous pyramid to course down towards the jugular foramen, and that is called the sigmoid sinus because it has an S-shaped. So that the blood which is coming back to the confluens will be bifurcating and going right and left so that it can come out both the right and left jugular foramen. The next thing that we'll take a look at is we'll reflect the dura, and then I'm going to remove one cerebral hemisphere so that we can see interior reflections of the dura. And we've already seen a little bit of that in the sense that we saw the falx cerebri as it came down between the two cerebral hemispheres, and of course it helps to stabilize the brain from movements in this direction. Now the falx, as it comes back, is going to change direction and form another structure which is called the tentorium cerebelli, so that this is coming across in a horizontal position, and it is going to separate the occipital lobe from the underlying cerebellum, which is still in place down here. Okay? Now on the inferior edge of the falx cerebrum is another dural venous sinus. It's actually really very small, but it also comes back and it's going to be emptying blood to the confluens. And the second major structure, which is also going to be contributing blood to the confluens, is derived from a very large vein which comes off of the bottom of the cerebral hemispheres. It's called the great vein of Galen. It's going to enter here, and it courses back in what is referred to as the straight sinus, and you can see that flows back at the intersection between the falx and the tentorium. It also flows back into the confluens. So that all of this blood, though, as it comes to the confluens, will then go to the transverse and then the sigmoid sinus.